Hi, I'm Dr. Tom Lewis, founder of Real Health Innovations. Real Health Innovations is a health creation company. We help people get well or reverse diseases from the root. Quarterback Your Own Health is one of our programs where individuals can come on our platform and work to improve their health. Let me explain a little bit of how it works. So we do root cause analysis. The first thing we do is assess risks. We don't want to find out what you have, diabetes for example. We want to find out why you have a health problem or why you may have risks that lead to a degenerative condition later in life. Our whole program is based on a book we wrote called Quarterback Your Own Health, How to Take and Lower Your Chronic Disease Temperature. And I'll speak to that in a moment. But if you want to find out what our process is like, get a copy of our book. It's a roadmap to good health. So the program that you can embark on in Quarterback Your Own Health to improve your health is a very simple process. You take our living profile. It's an online program you take with your smartphone, your tablet, or your computer. It's the living profile. It's intuitive and a precise assessment, and it provides you with a simple risk grade. Is your health, particularly with regard to chronic disease, in an A status or an F status or somewhere in between? The next thing we do is we provide you with actions. For every answer you provide in the profile that contributes to your grade, those are risks. And the actions are simple, health-correcting action items that you can carry out individually, or on the more complex ones, maybe employ a coach or a doctor. So self-directed or coach-directed. The last thing we do is our patented chronic disease temperature. There are very few or any tests, particularly blood labs, that are truly predictive or measuring of where you are in terms of your chronic disease status. Where do you lie on the health disease continuum? So what we've done is we've taken common biomarkers and amplified essentially their signal in terms of their ability to predict future risk of chronic disease or tell you where you are on the chronic disease spectrum. So how do you start the Quarterback Your Health program? Well, you go to quarterbackyourownhealth.com, and that's where you start. And it's a very simple process. You take our living profile. You get your risk grade, and you start reducing your risk by completing actions. Now just think about how simple this is. You have a health creation dashboard. Your car, your truck, has a dashboard that tells you the status, the health status of your truck. Now with Real Health Innovations and Quarterback Your Own Health, you do as well. So this person has a D, lots of actions, lots of risks to correct. They have 13 actions given to them as individuals that they can start carrying out. And there's some more complex actions which would require a health creation coach or a doctor. So how do you choose what's right for you? So here's a view of health from the New England Journal of Medicine and Harvard Medical School. We know that people exist on this continuum. The problem is people don't know where they are. Some people are high risk or very sick, one or the other, and some people are low risk. But there's a lot of people that are walking around well that don't really understand that they actually have a chronic condition brewing. It hasn't emerged yet in their body, but they're there. So we have a program where we measure this accurately through the living profile, assign a grade. The lowest risk people can just self-direct their care. Very high risk people require intervention from a health coach or maybe even a doctor. So let's look at this in more detail. So if you get an A, it's a self-directed health optimization program. You come on Quarterback Your Own Health, take the living profile, carry out some actions, start improving your health. If you get a B, it's self-directed health optimization, and then you may want to employ a health creation coach to help you along the way and keep you motivated to follow those actions. And you may have some more complex actions that a coach is very fluent at helping you overcome. A C, you'd get the self-directed health optimization program, a health creation coach. You may have an advanced coach that goes beyond, say, just dietary issues and gets into more nitty-gritty of health issues. And you may elect to do biometric screening to see how your risks are now translating into health through blood tests, because your blood doesn't lie. It tells you where you are on the health disease continuum. Let's say you got a D. You take this you can always do self-directed risk amelioration by completing actions. The rising tide raises all boats. Whether you're an F or an A, reducing risk will improve your health. Health creation coaching, advanced coaching, a health creation doctor. So someone with a D probably has something like type 2 diabetes or high blood pressure. The doctor will help you through actions to correct that. And then the biometrics. Where are you on the health disease continuum scale? And now, as you complete actions and remove risks, we should see that biometric score improving over time. And lastly, someone in the F category, and the people we're working with, we have many Fs. It's a high percentage of Fs actually. They would do advanced testing because these are the folks who have tried to lose weight and lost weight and then it came right back on. There's something in their physiology, a boat anchor holding them back. We address that through advanced biometrics testing. So creating health in our Quarterback Your Own Health program, it's easy as 1, 2, 3. Identify risk with a living profile. Take actions on your risk by completing actions that we provide to you based on the risk we determine in the profile. You can do it on your own, self-directed, or employ a coach or a doctor. And then the third is measure your progress with biometric screenings if you're in the C to F category. So what we realize in society today is most of the diseases we have, the chronic diseases which have proliferated, are quasi-self-induced. It's based on risks in our lifestyle, our environment, our behaviors and attitudes. We measure that very accurately and provide you with a self-directed or coach-directed or doctor-directed plan to overcome those risks, optimize and improve your health. I'm Dr. Tom Lewis with Real Health Innovations. I appreciate your time. Thank you.